Hey everyone, welcome back to USMLE Buddy AI. I'm Clara, here with the always awesome Jay.
Hey Clara, super hyped for today. We're talking about hyperglycemia meds, all those diabetes drugs the NBME just loves to ask about, right?
Absolutely. If you're prepping for Step 2 CK, you need to know not just the long list of drugs, but how they work and those classic side effects they love to sneak into clinical vignettes.
Yeah, like the phrase elderly woman on glipizide found diaphoretic and confused. Buzzwords everywhere.
For sure. So we'll break down mechanisms, the gold standard side effects, and give you the test taking tips the boards love. Ready, Jay?
Let's do it. Let's start with metformin, the big one. NBME can't resist it. So what's the classic buzz?
Right. So metformin's mechanism is decreasing hepatic gluconeogenesis and increasing insulin sensitivity. The superclassic board stem, obese patient with newly diagnosed type 2 diabetes.
Yeah, and the side effect you cannot forget is lactic acidosis, especially with renal dysfunction or IV contrast, right?
Exactly. Look for a patient with CKD started on metformin, now obtunded. Big red flag. They'll throw in high anion gap metabolic acidosis and expect you to connect the dots.
And test-taking Pearl, they love to ask what to do before starting metformin. Check creatinine. Don't start in GFR less than 30.
Totally. Okay, moving on. Sulfonylureas, think glipizide, glyburide. What do you watch for in the stem?
Classic is elderly diabetic with episodes of confusion after missing a meal. That's hypoglycemia. Boards love this one.
And they might phrase it like elderly patient treated with an oral hypoglycemic, now sweating and disoriented. You should immediately think sulfonylurea induced hypoglycemia, especially in the elderly.
NBME also slips in that sulfonylureas can cause weight gain, so they might ask which med to avoid in obese patients.
That's such a good point. Okay, how about thiazolidindiones, like pioglitazone? Boards love these for mechanism and for sneaky side effects.
Right, so mechanism here increases insulin sensitivity via PPAR gamma activation. Buzzword is promotes adipogenesis.
And what side effect do they keep hammering? Fluid retention. Look for new onset pedal edema or history of CHF started on diabetes medication.
So if the stem mentions heart failure, pioglitazone is the med to avoid. They love that question.
Exactly. All right, DPP-4 inhibitors, the mesgliptins, mechanism is increasing incretin levels, which inhibits glucagon release. What's the big board-relevant side effect?
Super rare, but they still ask pancreatitis, and sometimes upper respiratory infections. So if you see abdominal pain radiating to the back, don't forget DPP-4 inhibitors.
The buzzword association is sitagliptin and elevated amylase lipase. Keep it in mind.
SGLT2 inhibitors, here come the gliflozins. Super high yield. Mechanism, they block glucose reabsorption at the proximal tubule.
And what side effect do the boards love? Genital mycotic infections. Woman with recurrent UTIs after starting new diabetes drug, think SGLT2 inhibitor.
Also, volume depletion, hypotension, and on rare occasion, euglycemic DKA. Board certifying Pearl right there.
Exactly. GLP-1 agonists, exenatide, liraglutide. What's the classic stem setup, Jay?
Classes like patient looking to lose weight and lower blood glucose. GLP-1 agonists cause weight loss and have a side effect of pancreatitis and GI upset.
I see that a lot. NBME loves to ask which med reduces weight and provides CV benefit in diabetics. GLP-1 agonists is the answer.
And don't forget, if the stem mentions medullary thyroid carcinoma or MEN2, avoid GLP-1 agonists.
Last but not least, insulin. Always the answer when glucose is sky high, DKA, or glucose toxicity. NBME is obsessed with type 1 diabetic with infection, vomiting, and confusion.
Always give insulin for acute hyperglycemia emergencies, and watch for hypokalemia as a complication. Boards absolutely love potassium shifts with insulin.
Whew, that's a lot, but let's bring it home.
Review time, metformin, lactic acidosis, renal dysfunction, sulfonylureas, hypoglycemia, especially elderly, thiazolidiones, fluid retention, avoid in CHF.
DPP-4 inhibitors, pancreatitis, SGLT2 inhibitors, genital infections, volume depletion, GLP-1 agonists, weight loss pancreatitis, avoid in certain thyroid cancers.
And always review the stem for buzzwords, red flags, and comorbidities. That's where they trip you up.
Testing smart is half the battle. Read carefully, don't fall for common distractors, and always ask yourself, which side effect is the board's favorite here?
And with that, keep up the great work and crush those vignettes.
Thanks for listening to USMLE Buddy AI, everyone. Until next time, study smart, Stay curious.